Considerations relating to diversity and inclusion were very important for our study. More than half of the young persons served by Big Brothers Big Sisters are youth of color. Their families also tend to have limited financial resources, and for a considerable number, English is not the first language for the parents or other adults or caregivers in the home. So scientifically, on the one hand, it was important for us to have this diversity be well represented in our study sample. Otherwise, the generalizability of our findings to those who are served by the program would be understandably called into question. The representativeness of the sample also was needed to ensure that we had adequate numbers of youth involved in different demographic categories to be able to rigorously test out whether there were differences in program effectiveness based on factors such as a youth's racial or ethnic background. And that is a question that comes up frequently in sharing some of our initial results. So it was really important that we have sizable subgroups as well to be able to do that. And to promote diversity, it was, again, really helpful to have agency staff assuming such a key role in study recruitment and enrollment. By virtue of all of their training as human service professionals and their experience on the ground working with the families and children in their communities, they were really well equipped to engage with families in ways that were respectful of their diverse circumstances and backgrounds. We came to appreciate, in fact, that agency staff tended to be viewed as, I'll say, trusted messengers, thus increasing families' comfort with being involved in the research, if that was something that they were inclined to be interested in. Agencies also had bilingual staff that could be relied on to ensure that Spanish-speaking families could be enrolled and participate in their native language. I'm pleased to say that we were successful in achieving a diverse sample that really very nicely aligns with the backgrounds of the youth and family who are served by the program as a whole. So, just to give a little bit of illustration, nearly 40% of the youth identified as Black or African American, a third identified as Latinx. To help with, in effect, retaining this representativeness, our research team regularly discusses the importance of diversity considerations as we're then in the role of the follow-up context with families, and how we can be optimally attuned to all the diversity that we come into contact with the families and youth. So it's not unusual, for example, for families when contacted by us for those follow-up surveys to share grappling with some really significant, sometimes devastating stressors. Could be something like a recent job loss, health difficulties, the death of a loved one. These are all things that are things we hear about with some regularity. So really, make sure we express the appropriate empathy, concern when we hear these kinds of things. And our standard practice is to simply say, hey, we can contact you at a later point in time to come back and get contact with you about possibly doing the surveys. So not even to try to see, well, could you, I'm sorry to hear that, could you make time to do the surveys now, when their minds are potentially and understandably focused entirely elsewhere in their energies. So in doing so, we avoid the potential pitfall, I'd like to think, of placing so much emphasis on collecting data strictly according to schedule. It's like, Dr. Dubois, we have some that came in at 20 months, not 18 months, that, okay, we can work with that on the back end statistically. We don't want to lose out on the opportunity to engage as fully represented sample as we can, along with just being humane in how we're interacting with our participants. So this is, a little bit of just what we find to be a fairly natural but really critically important way we engage with our participants in the interests of both their well-being and our study priorities.